welcome to our second Inside Health event of the year. Today we're going to be talking about musculoskeletal conditions, which we'll often call MSK for short. And these are conditions that affect muscles, bones and joints. And they're conditions that affect millions of people every day, so it's a really important topic to cover. And today we are joined by Joe Askew, who is Bupa's Advanced Physiotherapy Lead, discussing the huge issue of arthritis, different types of arthritis, how people living with arthritis can manage their condition, but also importantly, we'll be talking a bit about prevention as well. And I'm also joined by Emily Partridge, and we'll be discussing my favourite topic of exercise and movement. Emily is Bupa's clinical lead for MSK, and we'll also be talking about what you can expect from the physiotherapy service too. We'll be answering loads of your pre-submitted questions, but if you do have any more specific questions that relate to you, then please do feel free to get in touch with the Bupa team. So my first guest, Joe Askew, and you're the Advanced Physiotherapy Lead at Bupa. So your role provides customers with effective care navigation to ensure that they access the right clinician to manage their problem first time, every time, which is so important. So welcome, Joe.
Thank you very much, Zoe.
So let's talk about arthritis. It's a huge topic that affects so many people. It affects, in fact, more than 10 million people just in the UK, and that includes people of all ages, so it's a big concern for our viewers. We chose to focus on this topic today because it does affect so many people, and I think let's start off first of all. Can you explain what arthritis is?
We can. So arthritis, the definition of the word just means inflammation of a joint, and so we classically think of arthritis as being a problem that causes pain and swelling and inflammation affecting a joint, or in most cases several joints. And historically we've always thought of arthritis as being a process of thinning of the cartilage, where the cartilage is gradually affected and starts to narrow, and we commonly see that with age. One of the problems that we always encounter with medical language is that we use lots of different words interchangeably. So you'll hear people describe arthritis as arthrosis or as arthralgia. That's quite common. Historically, people have often referred to arthritis as wear and tear as well. And you often hear people describing crumbling joints and degenerative joint disease. And this is a really important thing for us as healthcare professionals to try and overcome, because the language that we use is so important in framing things for people and the message that we're trying to confer. And using that language around degeneration and wear and tear, you risk instilling fear in people, and particularly fear about activity, when activity we know is really advantageous for people with arthritis.
Yeah, it's interesting, isn't it? I think in a lot of the work I do, working with healthcare professionals, I'm encouraging people to stop saying wear and tear and talk about wear and repair.
Absolutely.
Because actually we know that activity, well, it's one of the main treatments for arthritis, isn't it?
It is, yeah.
And there are different types of arthritis. So can you talk us through what are the many different types, but the main types of arthritis?
Yeah, so there's over 100 types of arthritis that affect people right the way from childhood and early adolescence, right the way throughout our lifespan. By far the most common is osteoarthritis. So we actually know that of that population of people with osteoarthritis, 2 out of every 3 of them will report that they were last pain-free over a year ago. So this has a huge effect on people, and it's a very disabling problem. And osteoarthritis is this process of inflammation and swelling within the joints that causes pain and disability. And we can think of this in 2 different ways, really. We can think about it as a disease, and so as healthcare professionals, we like to define things and we like to stage them, and so disease helps us as healthcare professionals to talk about arthritis. It's more important to think of it as an illness, though, and that's the way that it affects people. Yeah. And so these are the symptoms that people experience of loss of quality of life, of pain at night that stops them from sleeping, and of not being able to participate in the activities that they like to do. And so that's by far the most common type of arthritis.
And that's kind of, I think when you were talking before about, you know, the less helpful language that might be used, sort of a joint crumbling or wear and tear. That's kind of, we were talking about osteoarthritis there, weren't we?
We are.
Because we see a very different picture in what I think you're probably going to say next.
Yeah, which brings us on to rheumatoid arthritis, which is by far the more common of the inflammatory arthritis. And this is a very different type of problem to osteoarthritis. So in rheumatoid arthritis is what we call an autoimmune disease, which is where the body's immune system starts to attack the joints themselves. And this can cause quite marked erosion and destruction of a joint, the inflammatory process that goes alongside it. And that's a huge problem. We don't really know what triggers rheumatoid arthritis. We know that there are some potential links, and some of these are around lifestyle, and we know that smoking is a potential real contributor to developing rheumatoid arthritis. But there are also things like viral illness. There are some links with diet that we'll discuss a little bit later. There are also other kinds of inflammatory arthritis. So there's psoriatic arthritis that's linked to people with psoriasis. And then most people will have heard of gout. And gout is also an inflammatory arthritis where people have too much uric acid in their system, and that starts to get deposited into the joints as a crystal structure. And sometimes if that process is happening, they might knock their joint, and stub their toe is a common one, and that can disturb those crystals, and that causes a significant inflammatory response that's extremely painful and is associated with a hot, swollen joint.
And I guess the big difference there is rheumatoid arthritis tends to usually affect a number of joints, whereas gout tends to just affect one joint at any one given time. And usually it's the one that connects the foot to the big toe, most commonly, but not always. Okay, and I think one thing that is in common with all those, maybe not gout actually, but with osteoarthritis and rheumatoid arthritis is that actually exercise and other elements of lifestyle are quite important for management.
Very much so, really important. And we know that there are lots of lifestyle contributors, particularly to osteoarthritis. So what we see is that obesity is a real contributor to developing osteoarthritis.
I guess that just, it's the load, isn't it? The extra load that the joints are carrying.
It is. And also obesity tends to go hand in hand with other, what we describe as metabolic syndromes. So you see more commonly raised levels of cholesterol, you see more commonly diabetes, and you see more commonly high blood pressure. And we know that all of those things are linked to developing osteoarthritis, as well as contributing to the symptoms that people experience from osteoarthritis, and also with rheumatoid arthritis. And so anything that we can do to help with those and impact those is of huge benefit for people with arthritis.
So obesity is a risk factor, age is a risk factor, although it can affect people of all ages. I think that's probably the number one as well, isn't it?
And with osteoarthritis, that we tend to see that developing in people over the age of 45, really, because under the age of 45, that repair process that's happening in all of our tissues is able to keep up. Whereas once we start to mature, the repair process can't keep up as well. And we see that in all of our collagen tissues. That's why we develop wrinkles, and that's why we can start to develop issues within our joints.
Now, you mentioned earlier that you'd share with us more info on how diet is important when it comes to arthritis. So can you tell us a bit more about that?
Yeah, so we know that with rheumatoid arthritis, that high caffeine diets that are high in red meat, are potential contributors, seem to contribute to potentially developing rheumatoid arthritis. Right. We also know that obesity, as we've discussed, has a huge impact on osteoarthritis, both developing osteoarthritis and making the symptom profile that people experience worse. And so anything that we can do to help to impact that can have a profound effect. There was a relatively recent research study that showed that in people who are obese, so in people who have a BMI of over 30, if they could reduce their weight by 10% with a combination of diet and exercise, that their pain levels improved by 50%. Right. So you don't have to have a huge impact on BMI to start to have a big impact on the symptoms that people experience.
Yeah. I think there'll be many people who'll be thinking easier said than done, especially when your joints hurt. But also, you know, I think for a lot of people, just having that knowledge, that can be a real motivator. That can be the thing that makes them think maybe they've tried things before, they want to have another go.
Absolutely. And I think one of the key messages from this is for people to understand that exercise doesn't cause harm when you have osteoarthritic joints.
Yeah.
Obviously, it can be really difficult for people because everyone's experience is different, and pain can be a real limitation for people. But we know that with physiotherapy, we know that with exercise, and we know we've got good strategies to treat the illness. And so if people reach out to healthcare professionals, there is a lot that can be done, and people shouldn't be fearful of moving and exercise and activity.
I think the other thing in my experience is people are aware of joint replacements for knees and hips in particular. And I think sometimes people delay coming to the doctor or to the physio and seeking help because they think that that's the only option and they don't feel ready for that. They kind of think, you know, I've got another couple of years in these joints, but actually, as soon as you're having problems that are impacting your quality of life, stopping you doing the things you want to do, there are so many things, working with physiotherapists and other members of the team, that can be put in place to help and support them and maybe even prevent that surgery being required down the line.
Absolutely. And I think there's a real perception that having a diagnosis of osteoarthritis inevitably leads to a joint replacement surgery, and that there's nothing that you can do in that middle ground. You've just got to wait it out until your symptoms are such that you're offered surgery. Whereas we know that's absolutely not the case. It's actually, if we look at knee osteoarthritis, it's actually quite a small percentage that progress to having a knee replacement. Less than 10% in some studies. So there's a lot of people out there that manage really well without surgery, and some people do need surgery, and surgery for those people is incredibly effective. It's a great operation.
It really is. I think a lot of people are worried about that operation, but it's such a wonderful operation. I remember an orthopaedic surgeon, when I did my orthopaedics rotation, the surgeon saying, you know, tell your patients that the day after their operation, yes, they'll feel pain, yes, they might feel a bit woozy, but that joint, that's the best their joint's been for years, and that joint's ready to get up and go. And to give them that confidence that actually, you know, for so long it's felt unhealthy, but that joint is now, it's good to go. Jo, one of the common misconceptions is that arthritis is a condition that only affects older people. But what advice can you give generally to younger people?
So arthritis much more commonly affects people over the age of 45, but we see it in younger people also, and often that's as a result of injury. So one thing that people can do is take part in injury prevention activities, and people can guide that from a physio point of view. There's also really important lifestyle considerations, so healthy lifestyle, reducing obesity, reducing blood pressure, reducing cholesterol, we know contributes to reducing the lifetime risk of osteoarthritis.
When we're thinking generally about arthritis, and we're talking mostly about osteoarthritis here, we know pain in the joint, and that pain can be in different places, can't it? People can have arthritis in their knee, but they can feel the pain in their hip or the other way around. What other symptoms do people report? It's
often such a broad thing because people's experience of pain and people's experience of disability that can come with osteoarthritis can be really varied. And so classically it's pain and stiffness and a feeling of restricted range of movement. So quite often one of the things that people start to notice with hip arthritis is that they can't bend forwards to put their shoes on or their socks on because their movement starts to become a little bit restricted. With people who develop arthritis in their shoulder, they can't get round to their back pocket or tuck the shirt in round at the back. And so it's that restricted range of movement that then starts to lead to functional loss. So you start to struggle with your normal day-to-day activities, and that can then start to impede quality of life. But it's really important for us to remember that arthritis, and any kind of arthritis, is a whole person disease. This isn't just centred on the joint itself per se. We've got to think about the impact that not sleeping has on people, because one of the really common symptoms of arthritis is night pain that wakes people up, and not sleeping can have a really profound impact. these are often working age people, and that can have a really profound impact on work, can have an impact on your ability as a parent, and all the other things that we have to do day to day.
Jo, I think what the viewers would find quite helpful would be, how do you differentiate between the sort of normal aches and pains of getting older versus early signs of arthritis, you know, when you should seek help and go and see someone?
There is some overlap between what would be early arthritis and what would be normal aches and pains associated with starting to get a bit older and periods of increased activity. I think the really important thing is for people to know and understand when to get help, and when to access help from their doctor, their GP, or when to access help from another healthcare professional like a physiotherapist. And really, that comes down to quality of life and their ability to function. We tend to go off the patient's experience, and if they're starting to struggle with normal day-to-day things, and it's starting to impact their life and it's impacting their quality of life, that's the time to access help, because we know that we can put some strategies in place to help deal with that and do something about it. The same goes for night pain. I think, you know, there can be several different things that can cause night pain, but if people are experiencing night pain, then I think really they need to get in touch with their GP and have a chat about that. And
I always say, if in doubt, you know, if in doubt, just get it checked out.
Yeah.
I think, you know, there's a lot of stigma, I think, associated with ageing, and a lot of acceptance of arthritis as just a condition that you get when you get older and you should just put up with it. And I think our main message here would be, don't put up with it, because there are things that can be done to help. So don't suffer in silence. So what are the various treatments available then?
So really, the first line treatment with this is education and advice and understanding, is speaking to someone to frame things in the right way and discuss what you can do and what help you can access to manage these symptoms. And that should be the first line treatment.
It can make all the difference to someone, actually, just understanding more about their condition and what they can do themselves.
If exercise was a pill, everyone would take it.
Yes,
because it's not just the impact that this has on reducing your likelihood of developing osteoarthritis or reducing the symptoms of osteoarthritis that you experience. Addressing those things also reduces your lifetime risk of developing dementia. It reduces your lifetime risk of cardiovascular disease, heart attack, stroke.
Breast cancer, bowel cancer.
Yeah, mental health. There are a myriad of things that this influences, and it's so important. And so at the basic level, it comes down to that advice, education and exercise.
And it's that whole spectrum of care, isn't it? Available from the advice and understanding all the way through to surgery. That's why it's so important in your role that you're helping the individual person find the right clinician to help them right at the beginning.
That's it, and to see where they fit along that spectrum.
Thanks, Jo, that's so helpful. So I'm now joined by Emily Partridge, who is Bupa's MSK clinical lead. And Emily's a strong advocate of promoting health and well-being and providing a holistic approach to client care. Hi, Emily.
Hello.
So we're going to start by talking about exercise and movement, because there's this common belief that if you have a condition that's affecting your muscles, bones and joints, then the best thing to do is to stay still.
No, I definitely disagree with that one. Yeah, it can be a common misconception, actually, that if someone's diagnosed with a problem with their muscles or bones or joints, that they think, oh, I better rest. Going back many, many years, there probably was the advice about, for example, if you hurt your back, to lie down. Actually, as physios now, that's the absolute opposite of what we'd be saying.
It's the worst thing you can do,
Absolutely,
right?
It really is. And actually, exercise is really good for you, and it's going to have lots of benefits, while the lack of exercise could potentially cause some harm, really. There's so many benefits of exercise. So you keep your joints nice and lubricated, moving freely, you keep your muscles nice and strong, your stability, your balance. But also it's so much wider. There's just so many benefits of exercise. Things like improving your mood, your energy levels, your sleep, which we all know is super important. Exercise can boost your immune system. It's great for confidence. It's great for maintaining your independence, and great for socialising as well. So I'm definitely a massive advocate of exercise and all its benefits.
Absolutely. How can you be sure you're doing the right types of exercise if you have a particular condition, or maybe even if you have an MSK injury?
Yeah, I mean, it depends on what that is, and I'd always say seek advice from a healthcare professional, such as a physio. I'm going to be biased, being a physio, and Jo is too. But we are very, very good at guiding people into the right type of exercise. But generally, I'd say listen to your body. You know, if things are aching after exercise, actually that's a good sign you've probably
Sign
worked.
that it's working, it's
Exactly,
doing something,
yeah.
the changes that you want to happen are happening.
Absolutely. If suddenly your pain's getting significantly worse, I'd suggest we might need to adapt some things here. That's not to say that we need to stop the exercise that you're doing, but there may be some things that we just need to adapt, maybe the time that you're exercising or how often, or let's say if you were a runner, runners are quite notorious for just running. And I get that because there's lots of advantages. You just literally put on your stuff, go out the door and run for half an hour.
Yeah.
But I always say to runners, try and vary it up a little bit. You know, do some cycling or swimming, do some strengthening stuff, maybe a bit of stability, mindfulness stuff as well. So my general advice is seek help from a professional first of all. Don't be disheartened by having an MSK condition, and really kind of think of it as motivation. Go forwards with it. Listen to your body. Aching's fine. If something's quite sore afterwards, don't worry. Maybe just seek advice and adapt it a little bit.
So generally then, I think we're all agreed that for most people, getting moving is definitely advisable. Does it matter how old we are or how active we've been in the past? Is it ever too late to get started?
Never. No, absolutely no. It doesn't matter how old you are, whether you've exercised before, hand, or, you know, whether this is something new that you want to start doing. It's never too late. I'd just say look forwards, try it, try different types, make sure you choose one that you enjoy, and then just reap all the benefits from it.
And if people are apprehensive, maybe because of their age, or it's been a long time since they've done anything, or because they do have joints that are sore, how can they get started? How can you give them the confidence to take that first step? What sort of things can they begin with?
Yeah, so I think that's where seeing someone like a physio is really helpful.
Yeah.
That might give you that confidence, because if you are worried that you're going to cause harm, for example, then already you're starting on the back foot a little bit. You want to feel really positive about it. So I definitely sort of seek that guidance first of all. Talking to people as well, you know, again, I talk about socialising with exercise. You know, speak to friends, see what they like, go and join with them. You know, sometimes if you're walking into a class on your own, that can be quite daunting. Well, if you're going with a friend, it's, you know, it's a great chance to catch up as well, and you can join it. Your friend might like it and you might not like it. Doesn't matter, nothing's been lost, has it? You've given it a go.
It also means you're committed as well, doesn't it? Once you've made that plan with a friend.
Yeah, once you've said it out loud that you're going.
Out.
Yeah,
so
absolutely.
it's a good way of making a commitment. So moving on then, Emily, are there any exercises that you should absolutely avoid if you have an MSK condition? I think, you know, running is an example. I hear lots of patients say that I've been told I shouldn't run anymore, I should cycle instead.
Yeah. So you hear quite a lot about how running causes arthritis. And actually that's really not the case. You know, evidence these days shows that, you know, if you're a runner, you enjoy running and you've got arthritis, please continue to run, because actually it can reduce your pain. So
that's interesting, isn't it?
Really interesting.
A lot of people will be, I think, confused by that.
Yes, and I think I was actually at a spin class the other day, and there was a gentleman next to me, and he's got sort of sore knees, and he's like, oh, it's all the exercise I've done in the past. And I had a good chat with him about, actually, no, that exercise didn't cause your knee problems. In fact, it probably prevented more knee problems than you've got now. So I think running gets a bit of a bad name, and actually there's no reason for that. If you're a runner or you want to start running and enjoy running, please do, go ahead. That's also to say running isn't the answer to everything. Again, try a different, if you don't want to try running, try something else. Try this. The beauty of exercise is there's so much variety. Whether that's outdoors, whether it's indoors, whether it's at home, whether it's in a gym, whether it's in a class. So yeah, I wouldn't say there's anything particularly to avoid. Again, depending what that condition is, I'd always caveat that if you're seeing a health professional, they may be able to guide you and say, oh, maybe just right now, maybe don't do this just while you're recovering. That's not to say you can never do it, but there might be just some adaptations that you need to make short term.
So in summary then, Emily, all of us can benefit from exercise,
Yes.
irrespective of our age, irrespective of what MSK conditions we might have. And I think sometimes getting a bit of advice from a professional like yourself can really help give confidence and guide people further.
Yeah, and it might just be just a one-off appointment with, you know, someone like a physiotherapist. You know, that can absolutely be your key aim for going for physio. Can be just, you know, I'm okay with whatever my condition is, but the purpose of why I've come here is I just want some guidance about what exercise to do. Physios will love that. They will absolutely embrace that a person has come with that motivation. So yeah, they'll be more than happy to see you.
Brilliant. Thank you very much.
Okay.
I want to move on now to talking a little bit more about physiotherapy, your role as a physiotherapist, what it entails, what people can expect when they go to see a physio.